the coronavirus is continuing to infect a lot of people in the city. A government health expert says the trend has peaked, but it's hard to predict how long it will last. He warned residents to stay vigilant against COVID as well as strep-related pneumonia. Veronica Lin reports.
Recently, many residents have caught COVID again for the second time or a third time. Even those who have evaded the virus for 3 years are catching it for the first time. Professor Lau Yu-leung, a government health advisor who is a pediatrics professor at the University of Hong Kong, said while the infection trend has plateaued, it still runs rampant in the city, with around a dozen daily mortalities. Lau said residents should not worry much about these small waves. Mask wearing, however, should be adhered to on public transport. Apart from COVID cases, pneumococcal infections have also been on the rise, with the most vulnerable group being those under 5 or above 60. Professor Lau explained that if patients don't recover from pneumococcal infection within 3 to 5 days, they should consider taking antibiotics. He warned residents to not delay treatment, as the consequences might be severe if it were to enter the bloodstreams or lungs. Mike Kwan, a pediatric specialist who is an associate professor at HKU, said that the current 13-valent vaccines may not be enough to keep the kids from getting infected. The right step would be to import the more effective 15-valent or 20-valent vaccines. Kwan said that recently there's been an increase in respiratory syncytial virus, or RSV, among kids. This phenomenon is unusual during the summertime, he added. He explained that this might be due to the mask mandate, which led to very little exposure to these pathogens. He said patients should be sent to hospital for treatment if they have a persistent fever, difficulty in breathing, or inability to consume food. Veronica Lin, TVB News.